These days, removing unwanted hair through waxing, shaving and tweezing seems like something far from the past following the introduction of laser hair removal. Using cutting-edge technologies to seamlessly remove unwanted hair with less pain and less extra length, laser hair removal is the new trend. This method has been approved and deemed efficient by many in stopping hair growth as it targets straight to the root and follicles. Unlike waxing, shaving and tweezing, where these methods are very limited and less effective in dealing with hair growth. However, prior to diving deep into laser hair removal, or perhaps before getting yourself any treatment, it's best to know several conditions or precautions that you might want to take note of. Here are some safety checklists that you will likely find helpful and hopefully will help you in deciding whether such treatment is right for you, or perhaps reduce some of that nervousness ahead of your scheduled laser hair removal appointment. Changes in skin tone. Getting your laser hair removal treatment means that it will target the root of your hair and follicles, but really getting one also means that your skin will be making direct contact with the laser. To clarify, the laser used in the treatment does have radiation, but at a very minimal level, and will not penetrate into the organs. However, the colour of both your skin and hair is vulnerable to pigment or colour changes. It is also crucial to understand that since the laser targets the root of the hair, it also does preferentially target the pigment of the hair. As the hair colour is darker than the skin, the hair has enough sufficient pigment which can attract more of the laser. Treatment providers can usually get around this issue and safely treat all skin colours. However, the same is inapplicable to select hair colours, namely blonde, very light brown, ginger, red, grey and white hair. Prescription medications and medical contraindications. There are not many medications used in laser hair removal treatment. However, there are a select few worth mentioning, including those of Accutane, best known as a solution to treat severe acne problems. Accutane also makes your skin photosensitive, a cool medical term indeed. Some treatment providers suggest using it before getting your treatment, 3 months ahead to be exact. But do make sure to also consult with a doctor or professional who are set to take care of your treatment sessions. You might also want to take note about laser hair removal treatment during pregnancy. Whilst there are no studies that prove that laser hair removal is safe during pregnancy, many do not recommend it, especially for removal on the breasts and stomach area. So yes, it is best to wait until you or someone you know delivers and then wait out a bit before having any laser hair removal treatment. Your doctor or professional will likely tell you to do so for several weeks. Sun exposure. Laser hair removal treatment can treat all skin colours, but that of sun-exposed skin is far out of touch from treatment. Skin that has been exposed to direct sunlight will experience melanocytes in the skin to be very mobile. Therefore, the laser used in the treatment will target them without visible signs of tanning. Treatment providers usually recommend always using a mineral sunscreen of high quality and avoiding long direct sun exposure during the laser hair removal treatment. A slightly similar case applies to tattoos, as the laser is fairly attracted to the pigment. Therefore, treatment providers will avoid the areas that have tattoos and instead laser around them. The reason why tattoos are a no-go is simply that the laser will cause damage to both the skin and the tattoos. The skin primarily is vulnerable to burn damage. Preparation prior to the treatment. A few preparations you may take are mostly related to a skin routine. For starters, shaving ahead of the treatment is ideal, at the very least 12 to 24 hours before getting your treatment. And keep in mind, the cleaner the shave, the better the treatment procedure will be. Nobody wants to smell hairy smoked barbecue in the middle of the procedure as the laser focuses on the root and not the hair. Please refrain from oiling yourself ahead of the treatment or applying any similar lotion to the treatment area. Your skin must be well moisturised and not ready for the deep frying station. The treatment limits in treating very dry or broken skin. Other than not oiling yourself, you must also avoid waxing, tweezing, bleaching, and the use of depilatory creams 3 weeks ahead of the treatment at least. During treatment. You should not worry about this phase, as the person handling you will provide regular checks until the procedure ends, so file anything out of the ordinary that you may find during the treatment. Post-treatment. This part is more of a checklist of things that you must not do or must avoid to ensure the effective result of the treatment. A. Avoid being unprotected from direct sun exposure. B. Avoid swimming in chlorinated water at least 3 days post-treatment. C. Refrain from peeling or exfoliation of the treated area for a week. D. Refrain from using hot water on the treated area. To give you an idea, avoid hot tubs, saunas, steam rooms, hot showers and baths. This does not mean that you must go with cold water, however, you must go with lukewarm water. E. Perhaps the most important is to avoid working out or any physical exercise for 24 hours. Should you want to move around, light physical exercise can be carried out on the second day post-treatment, and then on the third, you can go beast mode on the physical workout, grinding out those muscles. F. Perhaps slightly related to the above, wear loose clothing to avoid sweating. So, does this safety checklist help you decide to take your laser hair removal treatment yet? Please like, comment and subscribe.